So I'm going to now emerge on a different screen because the film is on.
Adi, should we have Isha start off on an intro
please.
While you're doing the...
Yeah, please. Isha, some thoughts from you.
Thank you. Yeah, there's not really much to say because you will actually, see quite a, wonderful collation of the breadth and the depth of discussions that went on in the NEESAMA webinar series. Well, just a quick recap. So this was something we organized in the months of June, July this year, when, a lot of countries were still going through the first, second, third lockdowns or whatever. And there was, the pandemic was in full scale, and, there was a lot of mental health fallout from that, both in terms of individual coping, child mental health, different kinds of mental disorders like obsessive compulsive disorders. So, a lot was going on, in the context of the pandemic vis-a-vis mental health. So, which is why so Dr. Shekhar actually suggested that we do this webinar series. As usual, Sir's visions, give rise to so many wonderful things that we get to be a part of. So the series was called Mental Health and the Second Wave. And, we had speakers, quite fortunately, representing all of the NEESAMA participating countries. And all the sessions were quite well attended. I think the minimum attendance for a session was about 40 to 50, and a maximum was actually over 100. So in that sense, it was quite well attended, and the discussions, of course, were quite rich, given the expertise that all of the panelists came from. Yes, so that is it. I don't think I can add much more other than what the video itself will show you. So I hope that's going to be on now. Thank you, Dr. Aditya, for the opportunity to speak here.
It's absolutely NEESAMA and our pleasure. Here we go. Hope you can see it.
Yep.
Thank you.
Hello, everyone, and welcome to this first session of a 5-part series called Mental Health and the Second Wave. This is brought to you by NEESAMA, supported by Samvad. Just very briefly, NEESAMA is a collaboration among mental health professionals across the United Kingdom and South Asia. It endeavors to improve research, education, and clinical service delivery in mental health. Well, Samvad is supported by the Ministry of Women and Child Development, Government of India. It is located at the National Institute of Mental Health and Neurosciences, that is NIMHANS in Bangalore. Samvad is an Indian national initiative and integrated resource for child protection, mental health, and psychosocial care. I'd like to invite Dr. Aditya Sharma, who leads the NEESAMA endeavor, to tell us a bit more about this venture.
I just wanted to say a very, very warm welcome again to everybody. I understand we've got more than 540 registered delegates. That is the biggest turnout we've had ever for a webinar launched by NEESAMA. But as I said before, huge thanks to Samvad.
Well, moving into today's session now, the theme is COVID-19, a childhood in crisis. Before I invite the panelists to speak, I'd like to take a couple of minutes to clarify the scope of today's session. When we say a childhood in crisis, how do we interpret this? Are we, referring just to, so there are children and suddenly the COVID-19 pandemic has come and they all find themselves struck by this crisis? So is it just A hits B and that's the crisis? Or are we talking about a childhood being spent in crisis? Can any of us tell how long the pandemic is going to last? Do we know when we will finally get out of it? So is it this child now, or is it going to be this childhood for the better part of their life? What does crisis feel like when you talk to one single child, when you work with one single child? Is it one child's crisis versus what happens when we look at an entire generation, generations, if you will, there is a child in each one of us, and I'm sure every child is facing crisis in the current context. And looking at it, a bit differently, what do children do in crisis? What is this about? Is it about tragedy? Is it about hope, opportunity? Is it about grief, loss? I mean, you can think the entire spectrum of issues and emotions that are perhaps going through this young person's mind.
So since the COVID-19 pandemic began, and even after we had this second wave, what we have felt is like it has affected children across Nepal in a
brief you about the percentage of children in Afghanistan, family size and estimation on orphan. The situation in Afghanistan is very different with other countries. Nearly half of Afghanistan's population is under the age of 15. About 47.8% of the population is under 15 years. The average family size in Afghanistan is 8%. It is very different from neighbor countries and other countries around the world.
All children are not equal, but some seem to be more unequal than others. And this seems indeed to be the truth of how the pandemic is kind of playing itself out. I'd like to beat together what Gunjan and Hassan have said to really look at, step back and take a perspective on COVID in children and the kind of crisis that forms the essence and the subject of this evening's session. If you look at wave one, when we really started in February, March last year, before the lockdown was announced in India, both the narrative and the reality for children was of a certain nature. The reality was loss of structure, loss of routine, loss of predictability, loss of educational opportunities, loss of social spaces, and loss of play. This reality was also compounded by a consternation and confusion about what this whole thing was about, and the kind of fear that had already started, with the sanitizing and the masks and the kind of media stuff that were going on, and there was a built-up of anxiety, and a certain anxiety communicated from caregivers to children as well. And basically a restriction of both their internal and their external ecologies.
Sir, if I can stay with you, because you spoke about loss as something that was a major theme, is a major theme, will perhaps be a major theme as we move along this pandemic. But I want to ask you, what is, how do you understand, how do children process loss happening around them?
Let me explain this a little further. Let's forget about COVID for the time being, and let's look at the experience of loss for an average, intelligent child who is not an infant, who may still experience loss because of attachment experiences or lack of them.
related to the COVID-19 pandemic. So that's not exactly a school-based, but one of the areas that we reached out to were schools for ease of access, because we realized that since children were not reaching us, we had to reach them in some way or the other. So something that sort of materialized after a couple of months of the first wave was that they started conducting online classes in schools.
Hello, everyone, and welcome to the second session of Mental Health and the Second Wave, a NEESAMA webinar series supported by Samvad. I'm sure you'll all agree that as different parts of the world, as different parts of South Asia continue their fight and their struggle against the COVID-19 pandemic, there is an ever-brimming parallel theme, which is the need to get back to normal life on both personal and professional fronts. It's been called COVID fatigue. And increasingly, we realize that COVID fatigue is a very, very real and personal phenomena. The pandemic has taken a toll on physical and emotional health by severely depriving us of our usual coping methods. Some people are talking about the mental health impact as the fourth wave. So, there is the first wave of morbidity, mortality, which peaks very quickly with, COVID-19 coming in and then starts to settle down. The chronic conditions, the disregard for non-urgent, non-COVID conditions. So all of that, seems to peak in the initial part, and then it comes down ultimately. But the mental health impact, the psychic trauma, mental illnesses, new onset mental illnesses, economic injuries, burnout, all of this just doesn't seem to be leaving us, even though the COVID-19 illnesses may have actually started to diminish. And given that, especially in the case of children, when you have school dropouts, a lot of abandoned, orphan children, parenting stress, caregiving stress. So all of this just makes the problem that much more serious and intense. What arm or what kind of a mental health system background you come from, we're going to try and direct this session to the entire system and to see the kind of answers that we can generate. So the question that we're asking is, are mental health systems equipped to handle the pandemic?
Now, when we talk about the systems and what resources we have, and we just talked about what we don't have and what we do with what we don't have. It's a classic question. So, but the most important thing, what came out of the whole thing was, at least now people know about child mental health issues. People know that the children can have stress. And part of the training, what we also do is care over to pathway, pathway to care. So it's a very simple, PF is psychological first aid, basic stress management to the children. We have a little session on a stress management. We teach them relaxation, and we teach them on how to identify severe symptoms and when is the time that they should ask for help, and for the parents and teachers and caregivers, that when they need to refer and where to refer.
Huge benefits that we could benefit from, because I think even our own community services perhaps haven't had the reach directly into homes in exactly the same way, because of some of the COVID restrictions and some of the infection control guidance that we've been working with has perhaps created an increased anxiety around the ability to actually engage at that level. So I'm very heartened to hear of your experiences, and certainly feel that there's some lessons we can all learn there. Thank you. So from March until September, the various lockdown and restrictions appeared to be having an effect. But then when that was released over the summer, we did see a significant difference. I think our initial response was very much a major incident and surge response, which you're all very familiar with from your own experiences. And I think what worked well was that change to a command and control model to make decisions quickly. And nationally, the UK government enabled us and supported us with the support of the Department of Health to make decisions locally and focus on what was important for our services.
A very appropriate theme and requires a lot of discussion. So let me just start with this ominous statement that I read somewhere, that history teaches us that there will always be more psychological casualties than physical casualties as a result of disasters, and that includes pandemics. So that is something that we must keep in mind as we deal with the second wave and probably the third wave, and the waves will come and go, but the psychological sequelae are going to be there. Now, this is the treatment gap that was already in place in India before the pandemic started, and you can see that for most of the severe mental disorders, the treatment gap was more than 70%. Highest is for substance use and depression. It's also disheartening to say that this is not a statistic that we're proud of. India accounted for 26% of the world's suicide deaths. These are the people who did not have access to care even before the pandemic started. And this was the kind of resources that were available for our patient population. And the district mental health program, which was initiated to actually overcome this deficit of mental health professionals, has not actually been able to percolate to all parts of the country. So that was the background. And then you had the first wave, and then you had the second wave. I don't know whether to call it the second wave or the first tsunami, because that's the kind of increase in numbers that we see. And what happened? So there were 2 lockdowns that India experienced, and the impact of these lockdowns are that most of the government general hospitals were designated as COVID hospitals, which means that the mental health care in these hospitals were shut down. Outpatient services were closed across the major hospitals in the country. Only emergency services and IP care was there. Even what was available to access that, public did not have transportation. So the common problems that have been highlighted include stress, anxiety, depression, anger, fear, and suicidality, like I said. So these are adding to the problem that was already there.
So there are 2 components. One is, what kind of services you are trying to deliver, right? So our approach is providing basic psychosocial support, training them on identifying, rather than a syndromic diagnosis, we focus on trying to figure out what are the general symptomatology, that can be, red flags. Let's say somebody is having a suicidal thoughts, that's a red flag, right? So somebody is not sleeping, that's a red flag. Somebody, we had a referral where a child was washing his hand all the time. So, so we talked more about general symptomatology and what is a threshold for referral.
Comfortable using telemedicine for follow-up care. What about patients who need a first consultation or who need to be seen for the first time? How many psychiatrists or neurologists would be able to or would be comfortable providing telemedicine-based consultation for a new patient without actually being able to examine them? Now, this brings all these questions into play. And the most important question that I think we should raise is, how do you ensure quality assurance in a telemedicine-based intervention program, right? Now, that's the thing. We all have various kinds of accreditation. We all work with different systems which ensure that quality of care that is provided is good. But with telemedicine, there's absolutely no control. There's absolutely no. And what about other patient issues like confidentiality, which can go for a toss with telemedicine? So these are some of the issues. So telemedicine is here to stay. There's no doubt about it. Telemedicine guidelines are being framed by different countries, and it's imperative that all of us stay as close to the guidelines as possible, both in the interests of patient care as well as the safety of the treating mental health professionals. It's also important for us to look beyond the pandemic and see how telemedicine can become applicable and coexist side by side with the in-person mental health care. And it is very, very important for us to build in quality assurance. There has to be some audit of these telemedicine-based services that we're providing. Otherwise, it will be like, okay, it's like we're doing a favor to a person who has access to internet. We have to assure that they get the same quality of care that they would get with an in-person consultation.
We are at the 3rd session of the series that's called Mental Health and the Second Wave. This is brought to you by NEESAMA, supported by Samvad. So as we are going through the uncertainty, the illness and death that comes in, that the pandemic brings in, of course, the socio-economic costs, what is increasingly being realized is a very specific entity called the COVID stress syndrome. And of course, who gets affected by the COVID stress syndrome, it is people who have other vulnerabilities, as we understand for, all of mental health. So when you have more vulnerabilities, you're more likely to develop even the COVID stress syndrome. Interestingly, I'd just like to point you to a vulnerability, which is the 4th bullet point, that is OC features. So, in your personality, if there is anancasm, there is a tendency to obsess, to have obsessive compulsive experiences, then that also seems to predispose you to developing the COVID stress syndrome. So, so we know that all of this mental health impact is happening as a direct result of the COVID-19 illness and the pandemic. And then, of course, are all of the issues to do with the lockdowns, the constant experience of frustrated non-reward. Every time we seem to make plans, which, get thrown right back in our faces because there's a second wave and a third wave. The increasing distress, lockdown fatigue. I mean, everyone's tired of staying at home and not being able to go out. From mental health, are there going to be psychiatric, psychological sequelae? Pseudo-agoraphobia, a lot of frugality coming in, which seemed to have been the pattern from previous pandemics, germaphobe. So
we all know, I think we have been discussing this point that COVID is something which is not affecting the mental health problems are for COVID positive, but we need to also understand that it's affecting general population, people who are in isolation or quarantine. Whole lot of literature is there, and family members of patients, especially those who have died, and in that way. So the point is that it's not only COVID-19 patient, but mental health issues are much beyond that, and that is why people are calling it as a parallel pandemic or pandemic in pandemic, or mental health. I completely agree with Isha. The fourth wave, the mental health issues are going to be at the forefront.
1.5 years since we have been dealing with this COVID-19 pandemic, and I believe it has brought multiple other related issues that have completely uprooted our routines. And routine is the key word here, as I believe this can act as a crucial factor in helping us cope with our current situations and formulate strategies for future. Quite a lot of clients who would complain of symptoms like anxiety, stress, irritability. They would talk about things like lack of energy, there's lack of routine, blurring of boundaries, restlessness, and having multiple tasks at one time. And I must admit here that I have experienced some of these symptoms as well.
Of course, things are continuing to change for all of us. We're in lockdown, we're out of lockdown, we have restrictions. New variants are emerging, and things are continuing to be uncertain and to change on a daily, sometimes hourly basis, it feels. And often we have very little time to plan and to prepare for those changes. So children are sent home from school, people are asked to go into work and then to work from home. And it's interesting, when we talk to parents about the uncertainty-related anxiety their children sometimes experience, mums and dads often tell us that the sorts of strategies that they typically use would be to try and reduce the uncertainty for their child. So they try and make the world really predictable. They have lots of routines, lots of schedules. They don't take their children to unfamiliar places if uncertainty is an issue.
Just wanted to say, in addition, that's such a lovely question that is asking for what might be the difference between something that was quite devastating for the Indian subcontinent, the partition, or other calamities that have occurred. I suppose for me, one of the biggest differences, and this is more from a personal note, one of the biggest challenges has been that in all of these other calamities, you can interact socially and go through the process of grief. You can seek out social contact. Not all of it is possible, but even with strangers, you can hug them, you can seek them out, whereas the pandemic does not allow us to do that.
Actually, the health services are at the top, which are very minuscule. The major component is the community support, I think, and that is what we need to learn. Even we have been discussing in this pandemic also that the kind of material which has been made, the kind of education material, the kind of mobilization which has taken place is tremendous all over the world.
A big hello and welcome to the fourth session of Mental Health and the Second Wave, a NEESAMA webinar series supported by Samvad. It is mental health that is probably going to be the longest lasting wave of the impact of the COVID-19 pandemic. So whether it is from bereavement or loss, whether it is from the social restrictions that have come in, the impact on child development. So no matter what aspect you take, mental health is perhaps going to be the longest bearing brunt of pandemic. But now we also know that we've all been following some rules, we've been practicing certain behaviors, that is to keep ourselves safe from COVID-19, to avoid getting the infection. And what do these behaviors ask us to do? They're basically saying, clean again and again, watch where you are, how far you are from people when you're, interacting with them, avoid certain things. So all in all, it does sound like the pandemic, is asking us to be constantly preoccupied. And unfortunately, the preoccupations are of course not pleasant. They're either illness related. So how do I avoid illness? So that's what I need to be constantly concerned and aware about. Preoccupations about myself, where I am, who I am with, how am I talking, am I masked or not? So preoccupations about the self and about other people, whether in the family or outside. So the entire experience has been, something that has forced us to repeatedly think about particular behaviors and, normal practices and patterns of how we go about our daily lives.
We know that corona is an infectious disease. Several studies have found that an association between the existing psychiatric disorder and increased risk for COVID infection-related hospitalization, mortality, and morbidity. And the psychiatric patients are to have 2 to 3 times higher mortality rate than the general population. But the stigma makes a barrier between the people and the corona infection about properly using the mask, social distancing, and vaccination. They don't believe that all these measures will reduce the infection rate, mortality, and morbidity. They think that the COVID will not touch them.
Yes, we are talking about increasing numbers in OCD, but the points that you made also seem to suggest that there is a general vulnerability in some individuals, which might predispose them to more fear-related, information, threat-related information, and subsequently their actions are largely geared towards reducing this fear. And it's interesting that in the first wave, a lot of clients actually felt very validated and reinforced when they heard the instructions about having to wash repeatedly, keeping distance. In fact, we did have some clients asking us, isn't this true that my fear of germs is very right? And now what do you say about response prevention? So it threw a lot of challenges also for restructuring some of the beliefs. But what's also perhaps important for us to understand that what the situation of the COVID-19 pandemic has created in terms of increasing vulnerability of fear in individuals, what we know as the intolerance to uncertainty and ambiguity. And that as a general predisposition to fear, we see a lot of individuals actually with the heightened threat perception to crowds, to distances. And that unfortunately has probably reduced access to care and coming to hospitals also, because of course the lockdown is there, but they're also afraid of coming to crowded outpatients. And so we're not just talking about people who have known diagnosis of OCD, but also an increase in perhaps the anxieties of individuals related to health and uncertainty.
Considering our own obsessiveness and worries about OCD, reasonable or not, I think what I have in my own experience and my small team has tried to do is work with the parents more, so that some kind of some of what we actually talk of during their contact with us, they are able to kind of translate into when they're with their children alone at home. So some aspects of that security, as well as aspects of how to work with the OCD. So working more with families as a whole, and also I think there has been kind of probably moving more towards medicine a bit more, just so that because you don't have a lot of time as you would usually have.
Thank you very much for joining us today.
That was a fantastic video, I have to say. Apologies to some of you. I think because I was logged on 2 devices. Thanks to Shekhar for pointing out there was a bar across the video for some of it. So hopefully I've logged off from one. So yeah, but thank you, Isha. First of all, again, for taking the initiative and pushing me at times. I was quite lazy and tardy in getting back to you sometimes with things. A huge thanks, of course, to Shekhar for driving us all. But I come back, Isha, as you can probably see, everybody, the webinars were beautifully chaired. You summarized, reflected beautifully. And thank you all to all the speakers who, most of whom we recognize, and just fantastic that, the NEESAMA family came together to support this. I don't know, Shekhar, any reflections from you on the webinar series?
I have been, like I said, Adi, been in touch with the entire NEESAMA family to really get people to do more and more of this kind of stuff. And so after this was over, Sabahat has taken over to do a series on therapy. And, I hope to be in touch with our friends in Bangladesh and our friends in Nepal and friends in Sri Lanka as well, and discuss ideas with them to keep the momentum going, so that there is this sense both of, I think, partnership and ownership to what the spirit and philosophy of NEESAMA actually stands for. But coming back to the series itself, which Isha curated, I read recently, Adin, and I was actually going to point this out yesterday. There is a report that has come out from the UK, and this is someone called Helen Pidd who's written this, who says psychosis cases soar in England as pandemic hits mental health, and says that there is a 75% rise in referrals for first suspected episode of psychosis between April 2019 and April 2021. And this is the NHS data. And the rise continued throughout summer with 12,655 referred in July 2021. And up to 53% from up 53% from 8,000 in July 2019. So they believe, this is of course from a charity, and they say that the charity is urging the government to invest more money in early intervention for psychosis. Now, the point that I want to draw to your attention is that the word that has been used is not psychosis, but suspected psychosis. And therefore, extremes of anxiety or severe OCD, sometimes which borders on the irrational, and in the past, phenomenologically, we have heard terms like obsessive compulsive psychosis or psychosis comorbid with OCD, or mood disorders, which are comorbid with obsessive symptoms. What happens, for example, to mood disorders and the impact that the pandemic has, particularly in the depressive episode? So I believe that we are going to find more and more of these kind of variants in our clinical work as we go along. And I present this to you as an idea or as a context for NEESAMA to be both concerned about from a clinical perspective, but also from the perspective of an area that we would do well to research and to be in collaboration with each other with. Adi.
No, thank you for pointing out. Certainly, anecdotally, from being on call in the UK, we are seeing children and adolescents present in a crisis with more florid symptoms that we have ever been used to in the UK context. It almost reminds me of being on call as a junior resident in India, in a very busy emergency department. So that itself is worrying, the fact that people are, and it's true not just of mental health, it is also true people are presenting with late onset, late presentations of heart attacks, strokes, and are avoiding coming into A&E. So it's a very tricky one. You're absolutely right, and perhaps due consideration should be given to thinking about that. We've got a little bit of time, everyone, about 15 minutes, to maybe, I think if we could, with everybody's permission, have a little think about the point that Shekhar made about our sort of collective NEESAMA ownership. Thinking about, taking the webinar work forward. First of all, do you think there is an appetite for ongoing webinars? And I suppose the second thing is, Isha's done a marvelous job of collating it, etc. And now, thanks to Sabahat, there's work with on some psychotherapeutic approaches. So that will probably go on till about the end of the year, sort of Christmas time. We could start thinking about series starting in sort of mid-January onwards till about spring. So what sort of topics would you like to cover? And who might want to take the lead? I can provide tech support. Now we have, as I've mentioned, Maya Gaskell, our professional placement student who's helping us with NEESAMA website and other things NEESAMA related. So Maya could provide some help with setting up Zoom meetings, chasing people up, hopefully, which is, I think, what was the rate limiting factor with me. So as you all know, I talk too much, so I'm going to shut up and maybe just ask you all to unmute with or without your cameras on and just tell us, do you think we should do some more webinars? And if so, on what topics? Please don't all unmute at the same time. Thanks, Jackie, for setting the, yeah.
I mean, my sense is that they were very, very well attended and well received, and that there is an appetite for them and a desire for people to attend. So I think my answer to the first question, do you think we should continue to do them? I think is yes. That's easy for me to say because I haven't been involved in all the background organisation, and that I realise it's not inconsiderable, and everyone is very busy. But if there is a way that we can do that, then I think certainly there would be interest, which is great. In terms of what they should focus on, I guess I would kind of defer to others really to kind of suggest specific topics and whether there's some way that we could do some kind of straw poll or get some kind of guidance from the broader NEESAMA community on what people would find useful. Might be something that we could do, and maybe Maya could put together a little survey or something like that, so that we can find out what people would be interested in attending or think that their communities would find helpful.
Absolutely, Jackie. Thank you. That's a lovely, lovely suggestion that we could perhaps, the group here could propose some themes, ideas, topics. Then we can convert that into a sort of poll or a ranking exercise, simple, very basic. And Maya could help us do that. And we could even ask the NEESAMA community as to, if there's a particular topic, could they recommend a speaker, for example? As well, that maybe isn't in the NEESAMA community, but in their own country or otherwise. So, yeah. Thank you, Jackie. Mitali, did you want to come in at that point?
Actually, yeah, Dr. Hadi, I was just messaging with Run only, and we had discussed very early about how ECRs could also be delivering one series of webinars, because we all have different areas of expertise and research. For instance, Run is mostly focused on social anxiety. Mine is on abuse. Sobia's is on, she's working with offender related factors. And that all of that obviously is from an ELMIC angle. And Aisha is working mostly with education and counseling. So, I mean, of course, if you're having different series, maybe one series could be ECRs delivering the webinars, and the topics can obviously be discussed and be approved by the steering committee. But that was one of the ideas that we had discussed a long time back. So I thought I'll just tell you. Yeah.
You absolutely have. And thank you for reminding. It's a brilliant suggestion. Shekhar is applauding it. I think others will also probably agree. So Maya, could we just if you could make a note about a series of webinars led by the ECRs, what would be very helpful for Maya and myself. So Rand, what I'll do is I will do an email to you and I'll copy Maya in. Yeah, so you've got Mayor's email address, because Mayor Ran Serini De Silva, our ECR from Sri Lanka, sort of coordinates the ECR bit. And what Ran Serini can then do, thanks Ran for turning on your camera. Now Mayor can see you. So what Ran can do is collate topics, just as Mitali has talked about, criminology, education and counseling, child sexual and abuse, etc. So name the ECR and the topic, and then we can put that down and mention it to the wider NEESAMA community as well. So Ransarini, I will do that in the next couple of days. Maya is very good at reminding me and making sure that if I don't get things done, she makes sure they get done. So it's a godsend to have Maya. So that's one idea. That's brilliant. Any other thoughts on topics? Aisha, your camera's on. I wonder, did you want to contribute something on topics?
Yes, and thanks, Mitali, for summarize our plan. And as well as I was thinking that it was a very good proposal from Shekhar sir, that some collaboration with BRAC University and NEESAMA. And Professor Dr. Mehtab Khanum is the renowned psychologist in our country, and she's a public figure as well. So in our there will be a collaborative webinar that will be a very good work, and I can communicate with Mehtab ma'am because she is my direct supervisor. So that's a very good thing, I hope.
Okay, Aisha, it would be very, very helpful again if you could drop me if you could just put some details and send it to Ran. She can then collate all that information and share with Maya and myself. Then we can discuss it at the steering committee meeting. We actually have a steering committee meeting coming up in November. I'll just try and find the date and let you know. It's about second half of November, but yeah, we'll get back to you. I'll let you know soon. Yeah, that's very.
I also wanted to let people know that I have been in touch with the steering committee, and I have the steering committee's approval to actually do a collaborative webinar with the International Society for the Study of Trauma and Dissociation on community trauma, and I already have the acceptance of Udena Atigale from Sri Lanka, Arun Raj Kuwar from Nepal, and one of my colleagues in India. And it is going to basically cover earthquake in Nepal, the tsunami in Sri Lanka, to look at how systems respond to collective trauma as opposed to individual trauma that affects an entire region or an entire country. So this will be a collaborative webinar of the International Society of the Study of Trauma and Dissociation with NEESAMA, scheduled for some time in November. The flyers are ready. I'll be sending it to the steering committee as well as the governing council of ISSTD for approval. It'll be a 1-hour program, which I will be moderating, and we will send the links across. I've also noted Gunjan's thing on chat. Is it possible to have a link that could be shared with psychiatrists? And so, Gunjan, the way to do this would be, once Maya gets the website further developed and up and going actively, then all these events will be featured in the website. And of course, the news will be sent to all the NEESAMA members. And then you probably would have an email list. And we could consider in the steering committee meeting whether from different countries we have a composite list, like an email group. And so whether this needs to be done centrally from the NEESAMA, or whether each country or each of you can take the responsibility, we need to work out the logistics of it. So thank you very much for the suggestion. Farzana has spoken about a recommendation on training on research methodology. Farzana, do you want to say anything more on that?
Okay, I'm here. Good day to you all. But I was thinking that probably the response from us is not adequate the way you are actually offering different scopes for us, but we think that we are not responding enough. Maybe we are inhibited in some way, that we are very poor at research methodologies. Our researchers, this is my pickup, but this is a area where the early researchers has to be trained, has to have a good knowledge, like what we saw that from that Professor Naila Khan in Bangladesh. She is very good at research, but somehow I can see that she is in research everywhere, but somehow the next generation is not that research minded. So
thank you, Farzana, for
yes,
pointing that out. Now that actually this was the whole point, just to remind you all to actually at the 2019 meeting, because from the 2018 meeting that took place in Kathmandu, it was decided that the way to that, I think it was pointed out that us from the northeast of England, particularly those of us that are more research inclined, like Jackie and myself, and others like Hamish McAllister Williams, etc., that for us, the driver was mainly research in NEESAMA. And there was a slight disconnect in that our colleagues in South Asia were more interested in training and service development. I'm not saying everybody, but there was this thing. And I was very upfront that, the way for us to get things to keep NEESAMA alive, unless we got funding from Bill Gates or somebody, which is not going to happen, was really that we could, yes, Shekhar, I know you're ever the optimist, but let's be realistic. I mean, there's no reason why we couldn't try for funding from Bill Gates or Bezos from Amazon. If they're firing off satellites into space, then why not give us a paltry figure to run some meetings? But sorry, coming back, Farzana, that was the issue, and we respect that. We absolutely, this is a true alliance. Not us coming in and just wanting to take from South Asia. We want this to be jointly collaborative. And that's why we set up the 2019 ECR scheme. And in 2020, we had money. There was an ECR school that was being planned. Letters for visas were I had sent out already. I think Mitali was just about to apply. We were talking about her tickets to the US. There was lots happening, and then bloody COVID happened. Now, I have tried since to have an ECR virtual school. Doing things virtually is very challenging. It takes, for people to deliver the talks, it takes a lot more preparation for the lecturers. We shouldn't forget that there is a huge time difference. Like now, from next weekend, it'll be a 5.5 hour time difference as our clocks go back between even India and the UK, and then of course related changes as well. So time difference makes an issue. Bandwidth also, and Wi-Fi, because if everybody's cameras are turned off and there are only 7 or 8 people attending a workshop, the lecturers struggle with that. The lecturers have here said they are keen to help. They also said, could we pre-record a session? Now, the problem with pre-recording a session is it's not particularly interactive. You all could watch sessions on YouTube, for that matter, on qualitative methodology or learning about statistics, for example. So there is that. And then the other very practical issue that I've got at the moment is that I had my colleague, Dr. Lynn Barron Miller, who was, a postdoctoral, post-PhD doctoral fellow working with me. Unfortunately, she has left the university. So she was actually coordinating all of the ECR and various other events. I'm not saying that it's impossible. I will certainly try and re-galvanize efforts, but this will probably now have to be pushed back to maybe the spring of 2022 to think about some research methodology. I will also, I'm a member of the university's Faculty of Medical Sciences Global Exec. So I will ask them if there are any other resources that can help you all with research methodologies, because maybe other people are doing this work. And so could you join other early career researchers? For example, the university has a massive £20 million funded grant through UKRI, which is UK Research Initiative, looking at something called living deltas. So they are doing work on the Ganga Brahmaputra Delta, the Mekong Delta. And so they have a lot of collaboration in West Bengal and in Bangladesh. They're doing a lot of work in Sundarbans, etc. So I can certainly speak to those people and see if something is happening. So Maya, if you wouldn't mind, could you just make a note that we need to think about revisiting the ECR, that's Early Career Researcher training sessions. We won't call it a school, because a school would mean you would come for a week or 2 weeks. That I don't know when that will happen. We will revisit that, and also for me to take up at the Faculty of Medical Sciences Global Exec Committee to see if there's any other way that we can invite, you know, all of the ECRs and open it up to the wider NEESAMA community as well. I don't know, Jackie, did you have any further thoughts on things that we could explore at our end to support Farzana's request, in addition to what I've just mentioned?
There's nothing that kind of springs to mind immediately, to be honest. I think all the suggestions that you've made would, you know, are very sensible next steps. I'll keep thinking and see if there's anything obvious that springs to mind, but there's nothing in addition to what you've just outlined, Adi, at the moment.
Thanks. I know we're eating into the breaks. Shekhar, if I may, I know that there's bits on the chat, and I just want to address some things there there.
Very quickly.
Yeah.
Isha had actually curated a wonderful training series on qualitative research. And maybe we should ask her at some point of time whether...
Perfect.
Not immediately. Isha is busy with writing her PhD, but at some point of time...
maybe after.
We'd be happy to do that.
And I think, Shekhar, one of the things that you're pointing out to us is not just that this has to be done from Newcastle or the northeast of England. There is a lot of expertise in South Asia. This does not have to be, I think very politely, Shekhar is reminding us yet again, this does not have to be, apologies, I think I will refrain from saying what I was going to say, and I will tactfully say this, it does not have to be the global north always leading the way. There is a lot happening in the global south. What I would request is, Ran, if you could, speak to our ECRs collectively, and maybe think about topics, discrete topics on which you would like training. What we can, and if you could send that to Maya and myself and Catherine, and then what we'll do is we'll circulate that to the wider NEESAMA community as well. I will, of course, try and find out what is available. All the things that I have mentioned, I will pursue further, but I'll also put it out there to the NEESAMA community to see, is there somebody who could do that? Say, for example, I know Dr. Algin's very interested in geriatric clinics. Matthew has a wealth of expertise. So could there be something that Dr. Algin and Matthew might be able to do, for example, if there was an interest hypothetically in older people's care, for just as an example. But if Ran, you could send us that would be great. Just before we break up, Gunjan, the issue that we have about sending the link. We don't have a problem at all for you to share the link widely. So now that Maya is around, we can create, the problem with me is I'm pulled in so many different directions that if somebody just sits with me and says, you need to do this, 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 I get it all done. And then the link is there and it's sent out by a Catherine. Feel free to forward that to everybody. Okay, no problem. The issue for us to have people on a central NEESAMA webinar mailing list, again, we can do that, but we need people's consent. Here in the UK, we are subject to something called GDPR. Okay, I'm sorry, I don't know the full form of GDPR, but we do have to, I could get into a lot of trouble if somebody was to report to the UK government that I was sending unsolicited emails.
I see.
So,
oh boy.
so yeah. No, we really are subject to that. It's because, how if you were to just sign up, then this was really meant to be for online retailers not to share your details with others, because say Jackie bought something from Amazon, then Amazon decided, oh, we'll just share her detail, her email address with Nike and Reebok and Apple and all and sundry, and suddenly Jackie's inbox is clogged up with all those emails and she's having to unsubscribe to all of them. So it's because of, that's just a hypothetical example. It was set up with that in mind. Unfortunately, it's resulted in clinical and academic providers having to get consent explicitly to be able to even put you on mailing lists. I'm really sorry about this, but that is just the way, it's the law that we are subject to. And I'm a chair of a committee within the Royal College of Psychiatrists, so I'm very mindful of this. Sorry, Jackie, did you want to...
Well, I was just going to say, frustratingly, the retailers seem to have found a way around it. So we still get all of the emails from the retailers, but we can't actually store people's details without their permission. So it's kind of backfired a bit. I mean, one of the things we might be able to do for future events is if we ask people to register, we could, if we use kind of form builder type approach, we could have a clause on there where they actually indicate that they give permission for us to keep their contact details in order to advertise future events. And then we've explicitly asked for permission and we only save the email addresses and contact details of those people that click yes to that. And that would actually get round it. But yeah, at the moment we can't do that, and we absolutely can't share email addresses without permission. That would be a really significant professional issue if we were to do that.
Yeah, I mean, Jackie and I could get into trouble with the university, in my case with the General Medical Council. It is so serious that I could be struck off the medical register. That's how seriously they're taking GDPR. It was when we were still a part of the European Union and EU introduced GDPR legislation targeting merchants. Jackie is right. They found a way around it. We have left the EU, but the UK is still signed up to the UK equivalent of EU GDPR. Sorry, I know this can be edited out, please, in the recording. But just to share with you, it is not that we don't want things to happen, but we have a process. And we can absolutely, send out, in the form builder, we can ask people. But the difficulty I've noticed, Jackie, in doing this over the past 2 years with the various webinars we've done is people don't always tick the box because they don't realize in South Asia how important it is to tick that box. So we don't have their consent. So my request would be to all our colleagues working in South Asia, if we are sharing, if we find a way of creating this form builder, please tell your colleagues if they want to be part of the NEESAMA community / webinar community, please tick that box. Otherwise, we can't store their information. Legally, we're not allowed to. So that's one thing. I just wanted to also say, Maya, on the chat, Isha has put down a dedicated series on technology addictions, covering both clinical approaches and research methods. That would be fantastic. We can put that down. If you could add it to the list of topics. Thanks for that. And then similarly, we could get the information Matthew has put down that similar to what Shekhar mentioned, 12-session training program on geriatric psychiatry for postgraduate residents on YouTube. We did this last year. That's amazing. And Shekhar's pointed out that link could be put on to and embedded on the NEESAMA website in resources. So Maya and I am going to sit down once she's got access to the website, and this is the sort of information we need, what will go on what, yeah? Once the website is up and running in the next sort of hopefully a month or so, please look at it with a very critical eye and come back to us with feedback, and back to Maya and myself with feedback. The last thing also was we had just talking about training, and I know Farzana, you raised the issue about research training, but research and clinical training in the northeast of England, all child and adolescent psychiatry trainees attend an academic program on a Monday afternoon, which is term time. So it doesn't happen over Christmas, Easter, summer holidays, etc. But otherwise, it is from 2 o'clock to 4:30. We have previously shared this information with the NEESAMA community. I appreciate it's quite late in the night, because a 2 p.m. start means 7 p.m. in roughly in the Indian subcontinent, and finishing at nearly 10 p.m. But I'm not suggesting they're standalone topics. So for example, from early December, we are going to be covering the topic of adolescence. So typical adolescent development, followed by adolescent onset disorders like depression, bipolar, psychosis, eating disorders, etc. So this has been sent, this information. All you need to do is contact Catherine Parker if you want to attend a session. It is done over Microsoft Teams. You don't need to pay for it. It's free. Unfortunately, we can't record a lot of those sessions because they might have patient information on it or video recordings, which we, of course, then don't have consent to be able to record those and make them available for you. Yeah, but we will, what we'll do is we'll try and produce the timetable and put that down in the resources section on the NEESAMA website, so you can have a look at it and then just contact Catherine should you wish to attend that. So please share that widely. And there are similar equivalent programs for old age psychiatry and general adult psychiatry. I don't run that. I only coordinate the academic program for child psychiatry. But I can find out. Ran, you have had your hand up patiently for a long time.
No, I just want to mention with related to the research topics and such. I think previously when the ECR summer school topics were circulated, and then I think we had discussed with the ECRs and prioritized some topics. But yeah, I mean, definitely we can discuss a little bit more and think of maybe more contemporary topics that we really want training right now. But I think some of the other information is already is with on your end and available. Just wanted to highlight that.
Yeah, the other issue is that you might want training on, the methodology that Subia is using, for example, and we may not have it at Newcastle for so we can only offer what we can offer. But again, I think it's that issue. It doesn't always have to be Newcastle, diving into rescue, because actually collectively in NEESAMA, we have so much expertise together. This has been a helpful discussion, but and we have now totally eaten into the slot. We should have been now speaking to Gunjan and Mitali and hearing their experience. But if it's okay with everybody, could we take a 10-minute break or maybe a 9-minute break? It's 10:16. Come back for 10:25 and then restart. And I promise we'll discuss a lot about this. I have certain other updates about training, etc., that we can discuss towards the end. We have plenty of time today, so we can, it's not as structured as yesterday was. So see you all at 10:25, which is 9 minutes from now. Please don't be late. Enjoy a cup of tea or whatever you're having, samosa, gulab jamun, whatever. Welcome back, everyone. It's 10:25 in the UK. And I hope you're all starting to come back. As promised, I have my cup of tea. We should have done from 10:15 to 10:30. Dr. Gunjan Donju and Mitali Devgan, experience of attending our Child and Adolescent Psychiatry Higher Trainee Psychodynamic Training course. But we are going to start a little bit later than planned. I'll just give everybody some time to be back. Are folk back? Yes, I can see Dr. Algin. If you could just maybe put on the chat that you're back, because this was I think a really interesting experience. We tried to make it work this year. We have the higher trainees are doing the family therapy and systemic practice introductory course this year, but unfortunately I was unable to secure funding to be able to fund places, because there is a funding element required. So Mitali and Gunjan, if I could, I will just share how the training, sort of how this came about, and then over to you guys to just talk about your experiences, good, bad, and ugly. Also, please share any thoughts on how this could be improved. Yeah. What was your, because we want to try and get this right. Yeah. The context for all of this is that, as you heard, I mentioned that the child and adolescent psychiatry registrars, so these are people who have done medical school followed by 2 years of sort of internship, and they've done at least 3 years of psychiatry at a junior resident level. And now they have committed themselves to 3 years of higher training in child psychiatry. So this is the last 3 years before they're eligible to become a consultant in child psychiatry. So they're very senior trainees. They, my predecessor as head of Department of Child Psychiatry, Professor Anne Lakuta, who some of you might have met in Kathmandu, had set up this academic program 30 years ago. I have sort of updated it only a little bit when I took over from her around 10 years ago. It has a modular component, so it runs as early childhood, which is from infancy to about 5 years. That is the start of primary school. Then we have middle childhood, which is from about 6 to 11 or 12 years of age. So that's primary school age children. And then we cover adolescence, which is from 13 up to the age of 18. And we usually start with typical development, both from a physical perspective and from a psychological perspective. We also ask for input from speech and language therapy at times and other multidisciplinary team members. The session is from 2 to 3:15, is usually looking at a journal club presentation, which is chaired by either a very senior nurse or a senior OT or a consultant, followed by an invited speaker who presents on that topic. And the topics vary. And those are the topics that we'll try and get onto the NEESAMA website. However, at the start of each academic year, just to remind you all, the academic year in the UK starts in September, because we have our summer holidays, July and August. So it starts in September and ends around the middle of July the following year. And for the first term, that is September till December, they attend a psychotherapy training session, a formal training session at a sort of intermediate level. So it's not too basic, and it is specifically tailored towards working with children and adolescents. So it is not for adults or old age. All psychiatrists in training here, before they get to become a registrar, have already done a long case. That's 1 year of psychodynamic psychotherapy with an adult and under supervision, and at least 2 other modalities of short cases defined as 12 to 20 sessions of psychotherapy. So that is the context. And the autumn term, as we call it, September to December, it rotates, the training rotates between child and adolescent psychodynamic psychotherapy, which is what Mitali and Gunjan attended, followed by systemic practice and family therapy, followed by CBT for children and adolescents. So that's how it runs, on a rolling basis. So all of the registrars are able to attend all of those 3 training sessions to be eligible to become a consultant. Now, in the past, this has always been done face-to-face. So we could not offer it in 2018, 2019 to NEESAMA community. But because of the pandemic, the silver lining was that the training was being done virtually. And I approached a local charity for funding to run a competition for 2 people to apply. And I have to say, we got really high caliber applications, and it was blind. Catherine had removed the names of all the applicants. So we did not know it was Mitali and Gunjan's applications. And Ellie Smith and myself scored, and it was a unanimous decision that Mitali and Gunjan were on top. And then when we got to know who it was, we felt really happy as well, because you're such active participants of NEESAMA. So that is the context. I hope that helps you all to understand how training runs and why we were able to do it for the first time last year. Now I will hand over, you'll be glad to hear, to Mitali and Gunjan, and you'll stop hearing me for the next, hopefully 10, 15 minutes. Over to you guys.
Gunjan, do you want to go first or should I?
No. Please continue.
Okay. So first of all, I just want to thank everyone who was involved in making this happen. Dr. Adi, the whole NEESAMA team, and the Mental Health Foundation, because I remember that we were told later how this came about. And also Catherine, because she must have sorted out all the applications. I also want to thank Dr. Jillian. She was the facilitator and she was very patient with all the technical issues and, so many people in the discussion. And Dr. Pulkit and Dr. Monica, because they were coordinating who will go in what group. So the format was that it was done over 8 weeks. And every Monday for about 2.5, 3 hours, we would have the session. And the first half of the session, we would be given readings in advance to do, and we would discuss those readings. And then I think from the second or the third week, in the second half of the session, one person would present a case, and we were divided in 2 groups. So 2 people would present a case in each group, and then we would discuss about the treatment plan or how the formulation was done and all of that. So I think other than the fact that the papers, the reading material that was given to us, which is something that I don't think I would have been able to sort out on my own, that, this is what's important and this explains really well. So in that sense, the seminal papers that were sent to us for reading were really good, because they neither made the foundational concepts of psychodynamic approach too complex and neither too easy. So it was a right mix. And plus that was supplemented with, discussions as well. So in that sense, I think how this course has helped me is more to understand with which client this approach is going to work the best with. Because till now, till I took this course, I only had an idea of how these psychoanalytical, psychodynamic, how these approaches go in theory. But to hear, I'm forgetting to mention that each week we would have, in addition to Dr. Jillian, we would have one more specialist come in and talk about their experiences. So we moved, just like Adi mentioned, we moved from early childhood to adult, and we discussed concepts like transference, countertransference, trauma, all of these in the context of psychodynamic approaches. So I think in that sense, it has really helped me understand who these approaches are going to work best with. because we did hear about, like Dr. Adi just mentioned, that the registrars were working on long cases and short cases. So they brought in those cases in discussions, and we got to understand why, how they formulated, why they took certain decisions, what kind of questioning method is to be used with the client, and how sometimes it backfires, but sometimes when they take a pause in therapy also, that's something that I don't think in my experience of learning psychotherapy, people emphasize on a lot, which this particular approach really talks about pausing and also, you know, looking inwards and then relating to the client, and how the processes in the therapy makes you feel as a therapist. So I think in that sense, it was very good. I think I was the only clinical psychologist in the group. Everyone was a psychiatrist. So that was something new. And there were people from different cultural perspectives, which again added to the discussion. So I would say, yeah, I took back a lot from the course, primarily understanding with whom these approaches are going to work best, and also how do we formulate a problem that's not, psychodynamic approach is probably the optimum approach to formulate the case, instead of going just with, you know, CBT or some sort of behavioral or any other approaches. I think the only drawback for me was the time, but that's something that we can't do anything about. So by the time we would get done, it would usually be around 10 p.m. in India, and I think 10:15, 10:30, and 10:45 for Gunjan. So I think that was the only drawback, but that's not something that we really can do anything about, because everyone would be, a lot of people would finish their OPDs and their appointments and come, and some would even attend while, you know, sorting out the work. So I think that's the only ugly, as Adi mentioned, but otherwise it was a great opportunity. I think I would, if there's an opportunity in the future to go like one step higher and not just the foundation course, I think I would love to apply again. I'll hand it over to Gunjan now.
Thank you, Mitali. I think she's covered a lot already. But then, yeah, I would also like to thank everyone involved. Thank you, Dr. Adi. Thank you, Dr. Catherine. Thank you, all the other senior residents who were there, senior trainees, and also the facilitator and the supervisors in the sessions. So what I felt is, see, basically, psychodynamic psychotherapy has been taught to us during our trainings, but then it's not actually been taught, because we've been taught about the theories and, you know, what somebody had said once upon a time, but then we don't really know how that applies now. So we were taught about these things as a, you know, historical importance kind of thing, and then hardly ever used when it comes to clinical practice. But then so when we had all those discussions based on even the cases within the reading materials, and also bringing up our own cases, and then sort of leaving everything out, and then taking a psychodynamic lens to sort of analyze those cases and try to get a better understanding about what was actually going on in the psychodynamic aspects of the depth of the cases. So I think all of that made it very interesting. And yeah, a lot of the reading materials, definitely they were very dense. You would have to go through a particular paragraph a couple of times and then try to figure out what was actually being said. And then sometimes you would think that, okay, this is what is being said. But then after a discussion, there would be 2 or 3 different other interpretations, which would all make sense. Contextually, you would have to choose what to go along with. And that's when the supervisors came in, and then they would give a completely different perspective altogether. So all of that made the discussions even more intriguing and, you know, thought-provoking in a way. And yeah, the reading materials, those were basically the original papers. So it was not somebody else's interpretation of what some guy had said once upon a time, but then it was actual words that were written by the scholars back then. So I think that's what made it extremely rich and a very, very valuable resource material. And it was almost like time traveling to be able to, go back in time, be in their space and their thoughts, and to try to understand the cases that they saw back when they were writing about these things. So yeah, that sort of made it really a wonderful experience. So besides that, what I feel is that even now, even though I'm not doing psychoanalytic psychotherapy, it cases that I'm seeing, but then there will always be that psychodynamic aspect in my case workups. And then, whenever a particular theme comes up, and then somewhere in the back of my mind, I'm thinking about it in a psychodynamic perspective. It sort of has helped me to understand the issues better, and also has improved my engagement with the client, as well as helped me explain things, especially when we see children and adolescents. It can be difficult to explain things to the parents, but then I think this understanding also sort of helps you give them somewhat of a explanation to what's going on and how it might be affecting them, because we're not talking only about diagnostic criteria anymore. So it's a different depth of information that they would also benefit from. So it's basically helped me with developing a framework for management, conceptualization of the case, and also to plan for any kind of therapeutic work. So what kind of themes might need to be covered, even though we might take a different approach other than psychodynamic, but then that choice is also influenced again by the psychodynamic understanding of the issue. So yeah, I think overall it was really fun. And talking about the timings, that was not a big problem for me because I'm a night owl. I usually sleep very late. So that was not a problem at all. But then, yeah, it was always fun. And like Mitali said, if there's another level to it, please do let us know. It would be wonderful. Thank you so much for this time.
Thank you both. I'm really quite, I think hearing from you what an impact it's had and a difference it's made to your own professional growth and that of how you view clients and where it's helped is actually quite moving. It's really nice to see some very tangible impact. If I may just add, thank you for obviously thanking the organizers, Gillian and the team, and Catherine for her support. I've previously thanked Ellie, who's just logged on as well, for helping shortlist. We felt that Ellie and I have both been through the course ourselves, so we knew what the requirements were and who might benefit the most when we were going through the applications. I spoke to the higher trainees as well, and as to how they felt having you. Did they feel that? What impact did it have? Because, and I spoke particularly to the higher trainees. So those that have done training modules just, as a group, like the family therapy and the cognitive behavior therapy, and, were in their last year of training, they absolutely loved having you both there. They felt it enriched the sessions for them. You brought a different cultural perspective. You brought a different narrative of cases that perhaps they don't see in the UK context. And this came from trainees who had themselves done psychiatry in India or in other countries internationally, from Egypt, etc. as well. So, I think it was a bi-directional thing. You feel enriched, but actually so do our higher trainees. And this is why I'm particularly sad that we couldn't attract funding in time to invite people to attend the systemic practice and family therapy training course. Mitali, your point is very well made about the timing. The issue, of course, is that conventionally, this was always done as in the afternoons. But there is no reason why, with careful planning, we start planning these modules 6 months in advance. So with careful planning, we can definitely try and move it to a morning session, because not everybody is a night owl like Gunjan, nor should they be. Not very healthy, Gunjan. As you get older, your circadian rhythm will not thank you. It's something that we can definitely think about moving forward. The challenge will be that sooner or later, these are hard concepts. So sooner or later, whether I can persuade the organizers to adopt a hybrid model, and by that I mean that our higher trainees are there in person getting the training, but we can still use cameras to stream it via Teams or whichever modality. They're using Zoom actually for the systemic practice and family therapy training. So I'll think about that. The second point that you have made is wanting to know whether there's further training. Absolutely. There is an MA in psychoanalytical studies. It is run by, so the only place that does formal training, as you probably know, is either the Anna Freud Center in London or the Tavistock. So the Tavistock is a very famous NHS trust, which has some highly specialized services. The TAVI has a child psychotherapy training program based in Leeds. So the course is an MA in psychoanalytical studies that is led out of Leeds. I can certainly, Maya, if you could take a note, I can certainly try and find out whether there are, what levels of training there are and what the costs are. Of course, the costs will be fairly prohibitive. Even for people here, they normally are funded via their employer to attend. We're talking tens of thousands of pounds to attend the training. I'll have to see if we can get that funded somehow. It would be nice, wouldn't it, to get Bill Gates funding? So yeah, but I will pursue that, and I will come back to you in due course, if you could give me a little while. Shekhar has just pointed out, and I had noticed it as well, we are delighted, I have to say, to have Hakimullah, Dr. Hakimullah Salah join us from Afghanistan. Welcome, Hakimullah. Hakimullah and his colleague had traveled to be with us in Dhaka. They came all the way. It was an extraordinary journey for them. And unfortunately, they spent 12 hours at Dhaka airport. It was quite difficult because they were not, it was complicated, the immigration. I don't want to re-traumatize you, but perhaps we could just briefly hear from Dr. Hakimullah. Hello, nice to see you.
Hello, how are you? Nice to see you, everyone. It's my great pleasure that I have you all colleagues. However, I have heard the name of all colleagues through the email exchange with each other, but only I have introduction with Professor Ade, except others. So it's I'm very happy to join with you. After a long time. Actually, you know that the situation of our country, Afghanistan, our unstable situation in our country, and also we pass a very bad crisis of COVID-19, and also the changing of our new establishment. This was a big problem, and also my engagement with some other issues. For example, I was the government, the public, the public health giving me this big the responsibility to me, that because we are as a leader of the association, that they given us a big responsibility that I have managed one of the biggest hospital of COVID-19. And during this 1 year, I was very busy with in this management of this hospital. I was working there at 24 hours. However, that I was tried to join with you, but unfortunately, the time didn't given me that the opportunity to join with you. So it's my great pleasure. After that, I will join in this meeting, in this and we will share all our issues from Afghanistan. Actually, I don't know that most of you don't know me, that as Professor Ade introduced me, that my name is Dr. Hakimullah Saleh. I'm from Afghanistan, and I am the president of Afghanistan National Psychiatrists Association. We established this association since 4 years, and I'm very happy to join this great team, and we will continue our coordination and contribution with each other. Thank you very much for us.
Thank you, Hakimullah. I just wanted, Jackie, perhaps if you could also say hello. This is Professor Jackie Rogers.
Hello, it's so lovely to see you and to meet you at last. You're so very, very welcome. And I'm delighted that you're able to come today. So I'm based at the same university as Adi in the UK. I'm a psychologist by background, and I'm a professor of psychology and mental health, but my work focuses on autistic people and their mental health experiences. So welcome, lovely to see you, and really happy that you are able to join us today.
Yeah, thank you, Jackie. Jackie and I, sort of jointly represent the steering committee from UK on NEESAMA, and I think you know some of the other people. So I just wanted to introduce Jackie as well. I think Shekhar said it very well on the chat. It is really our honor to have you, Hakimullah, because you're right. We have had some correspondence over the last year. You told me how bad the situation was with COVID, and you were managing the hospital. I hadn't realized you were living there and doing it 24/7, 24 hours, 7 days a week. That is, I think words escape us collectively, really, as to all that Afghanistan has had to face. It is just a never-ending struggle. But perhaps, what I suggest is if you could stay with us, Dr. Hakimullah, for a little while, and maybe at the end, we could all think about, what the next steps might be. Is there something that we can do concretely to help you, training or other things that we can help you with in Afghanistan? So I hope you'll be able to stay on for a little bit longer, and we can talk about that. Yeah.
Thank you. Just I will tell you one issue about that. Fortunately, that all of these associations around the globe, especially that that we are the member of a World Psychiatry Association. I will thank from Professor Afzal Javed, the president of WP. He established one committee, that Afghanistan Support Committee, and for support our mental health situation in Afghanistan. So I have communication with them, and they start their the contribution with us, and also he assigned Professor Khalid Mufti to manage this committee, and they gather all the associations to how contribute with Afghanistan. You know that the World Bank have banned their contribution with Afghanistan, and also the United States freeze our money. So this situation is affected our health situation in our country, unfortunately. This was the big problem in our country. So we also need your support, and this team that we have with us. So we need your support. How can you support us, and how can you support our psychiatrists? You know that we have a limited number of psychiatrists in Afghanistan. In 35 million population, just we have only 129 psychiatrists in Afghanistan. So how can, if we imagine that how we manage all that, that we passed about 4 decades war in our country, and all population of our country are affected from mentally. So we need your support, that how you support us and all the colleagues from other countries, like from Bangladesh, from Sri Lanka, India, Pakistan, and other countries, that support our psychiatrists and support our psychologists about their capacity and about their other training and other opportunities that you have.
Thank you, Dr. Salah. It's really nice to hear that WPA are already being so proactive. And we can certainly discuss, and open up discussion later how we can do this. We'll now come back to the agenda. And the next session was to talk about and hear from, if you bear with me, I'm pretty sure, I just don't want to say the wrong thing. Yeah, it was to actually hear from those of us who had attended the BAP event. So as you know, that the British Association for Psychopharmacology, Professor Hamish McAllister Williams is the Director of Medical Education. Some of you have met him. He works at Newcastle University, and I lead on the child psychiatry module. So I had requested the council to give 2 free spaces at each of the training events. Dr. Alkin has attended some of the training session. So if I could invite Dr. Alkin to tell us which sessions she attended, and also just some thoughts and reflections on how it was. I hope Dr. Alkin, yeah, and Biplab, it's fantastic to see you. We'll come back to discussing your comment that you've just put in the chat later on as well. Thank you. So over to Dr. Alkin.
Thank you, Adi. I like to thank NEESAMA and BAP UK that they arranged fantastic sessions on psychopharmacology, and I first joined the 3 class on last year in 25th, 6th, and 7th November, I think, and this year in October. And the classes was from 2 p.m. About 7 to 8 hours at a time. So it's a difficult. It's a long time to stay at a time in a sitting posture. So, but I enjoyed a lot those classes, because the lectures were very fantastic. From they discuss anxiety disorder, stress related disorder, bipolar disorder, depression, and then all the psychotropic drugs like antidepressant, antipsychotic, the phenomenology, and their pharmacokinetics, dynamics, everything elaborately. And that correlate with the clinical discussion also. The teachers were very fantastic. I could not I could not recall all the names, but some of them are very, very nice presentations. And it was a very brainstorming session, because there is some difference between the applications of the drug or the use of drugs between from our culture and their in Western culture. And so it is very and in some cases like that, we in our practice, most of we use the valproate in reproductive ages. We do not care about those subjects. But after having these sessions, after having the classes, I like to practice that avoiding the prescribing these drugs to also me and also the students. So we are now aware of it and we're beginning the prescribing the drugs. And the last classes, the old age psychiatry, and that was also new to me, because this type of classes we never get before. And the group discussion, the group discussion was very good, but that was the following is a little bit a little bit I could not follow. Yeah.
Little challenging.
Yes, little challenging. Yes, yeah, it's a little challenging. The group discussion I could not follow properly. That is so. If it is these sessions, if you can arrange more and more or frequently, so I can be habituated, or we can be habituated to that discussion or phonation. So I will be benefited more in those sessions, I think, and that's all. It's a very good, nice session. So I like to another session, that is the session in child psychiatry. I think so. That child psychiatry with the pharmacology. I think I will attend the next time in next session. Okay, thank you.
Thanks, Sultana. Thank you for your words.
And thank you also, Isha Sharma, and Sambad arranging the webinar. And they invite me, and you also invite me for giving participation on the OCD. Yeah, thank you, sir. Thank you.
That's fantastic. Thank you, Sultana. And so, unfortunately, Sultana, the BAP is moving to face-to-face teaching from next January. So the ability to attend these meetings virtually will stop. I have tried to ask if they could adopt a hybrid approach. That is, that some face-to-face teaching and some teaching, online. But at the moment, the answer is no. So, because also even for this year's child psychopharmacology course, we had delegates who attended online. From New Zealand, Australia, Qatar, and Nepal. There were various people from across the world, obviously from Europe as well, but it was really interesting. We always get delegates from Australia, New Zealand, and Southeast Asia, like Thailand and Vietnam, but they come in person because they can get funding from some sources to come to UK and attend the training. But I know it is challenging. So unfortunately, as things stand at the moment, the training is moving face-to-face from January. So this is the last time that we can organize the BAP training virtually. But we will discuss how we can do some training online. We'll come to that a little bit later in the discussion. I'm sure everybody wants to have a discussion. Also, a very warm welcome to Sabahat. Thanks for joining, Sabahat. Sabahat's been very busy organizing a new semester at Capital University in Pakistan. Sabahat is our steering committee member from Pakistan. I don't know, Sabahat, are you?
Hi, can you hear me now?
Yeah, we can, Sabahat. Hi.
Hi, I'm very grateful for organizing this event. I think I always enjoy the NEESAMA meetings and would like to contribute, although I would like to contribute more, but it's the time constraint I struggle with. In this respect, we've organized one webinar and looking for arrangements for the second and the third one as well. So I look forward to that. I'm also excited to hear about other people's experiences. I think we've done a lot keeping the COVID scenario in mind. We've achieved a lot during this year.
Yeah, exactly. Thanks, Sabahat. We saw, unfortunately, we missed that bit, but we will make the recording of this session available. Isha and Shekhar and the Samvad team put together some clips from all the webinars that Isha had shared. I just wondered, would you be able to share how the first webinar went? Unfortunately, I was on leave and Shekhar also couldn't join. Just some reflections on how the first webinar.
I think we couldn't record it because I didn't have the co-hosting right, so because of that we couldn't record it. I think in terms of learning, it was interesting. as the presenter was presenting some real life cases, I think a lot of people took interest in that and they could relate to that context. We got questions with reference to that as well. And what we did was that we took the questions, then we formulated, we sent it back to the resource person. She wrote the answers and we put them into a consolidated document and circulated them among the participants as well, so that they get the answer. Because there was limited time, so we couldn't answer those in that session, but I think it was a pretty good learning experience.
Yeah, no, thank you. And apologies, that's a bit of an oversight from me when I set up the meeting, that I didn't appoint you as co-host because you could have recorded that meeting.
Sure, no, I think it was a learning experience for all of us.
Yeah, exactly. Hopefully we'll get it right the next time around.
Yeah.
As well. Okay. So with that in mind, we were supposed to take a break now from 11 to 11:15. We are, as always, running a little bit late, but not too much. So what I propose is we take a slightly longer break. So we come back at 11:20, which is 13 minutes from now, 1-3. So please match that for local time. And then we will hear from the ECRs, their feedback about being an NEESAMA ECR. And then what I propose is we think about how do we take the agenda of training forward. Because as the world reopens, as you know, the BAP is now doing face-to-face training. The opportunities might reduce, but I'm sure that we'll come up with creative solutions on what can be achieved and done. And we will also listen a little bit more from Dr. Hakimullah about the situation in Afghanistan and maybe a couple of concrete things that we might be able to offer, with colleagues, again, not just from the northeast of England, but from within South Asia, what can be done to help. Yeah. So see you all now in 12 minutes, because I've eaten 1 minute by yakking. So see you all at 11:20 in 12 minutes time. Welcome back, everyone. I don't know whether you could see some of the screen show. I don't know whether it was coming on or not. I tried to collate some photographs from 2018 and 2019 meetings. So, right. So without further ado, I'm going to hand over to our lead ECR, as it were, Ran Sarini from Sri Lanka. You coordinate the ECR work. And so we have 3 ECRs, NEESAMA ECRs at the moment logged in. We've got Aisha from Bangladesh, Mitali from India, and Ran from Sri Lanka. Over to you, Ran.
Thanks, Adi. Hi, everyone. Nice to be here. And I think first and foremost, I really have to thank the NEESAMA Steering Committee for the ECR initiative and having us on board and training us, and I think giving us the opportunities to become better researchers and practitioners in the field of mental health. So being a NEESAMA ECR has really been a wonderful experience for me personally. I think getting the opportunity just to learn and connect with the forerunners of mental health in research and practice in South Asia and Northeast England, that exposure can't really be, I think we underestimate that exposure. That also, I think, makes us better as ECRs. Specifically, I personally participated in many of the NEESAMA webinars that were relevant to me or captured my interest at every opportunity available. I think especially around the pandemic, some of the webinars were really very useful, and I personally use that into my own teaching or my own practice as well. So it was very useful. And I got the opportunity to come aboard as one of the collaborators from Sri Lanka for the Cope with COVID study and contribute to this key research that Adi very wonderfully presented yesterday. And I think as much as I contributed to the research team as an ECR, I have learned from that experience, and I'm continuing to learn through this. And something I don't think I got the opportunity to mention at this time. Adi, you had, I think, recommended me as a +1 reviewer for the the paper you published previously with Divya and Dr. Padi. So at the time, I think when you were asking, there were delays from PLOS One, then they hadn't reached out to me. But at some point they did. So I ended up becoming one of the reviewers for the paper. And this was the first time, I think, an international journal, I did a peer review for an international journal. So I was very self-conscious and I wanted to push myself to learn and train. So I went and I engaged in the Web of Science peer reviewer course to brush up my skills. So I think that also really helped me, obviously, with research skills and reviewing skills to become, I suppose, a better researcher as an end result. And then I think in the past 2 years, I was also involved with Professor Pianjali in the translation of Prof. Jackie's adult anxiety scale into Sinhala language. And also not to mention, accessing some of the extremely useful and thought-provoking sessions from the CAMS academic program. I must say, I participated in the sessions that were truly very relevant to me because of the time difference. Because it was extremely difficult after a long day of work and then having to sit down again for the night time. But I did wherever I could, and I was in touch with Dr. Pulkit, trying to see whenever I could come on board. But once I did participate, even in the journal club sessions, they were really, really amazing, very reflective and very sort of, intellectual. And I felt that that was very useful because you don't find a lot of such programs at that sort of level for practitioners to be accessed, because in Sri Lanka also psychology is very much a developing field. So we have become the seniors, but for us to get that exposure, I think that's very useful and very relevant. So I would really like, when you said to inform Catherine if I'm interested for the next round, I definitely will be, and I probably will reach out to Catherine and make use of the program again. And on top of that, I think once COVID hit and we realized that the NEESAMA will probably not meet in person in 2020, the ECRs decided to sort of initiate and begin these bi-monthly meetings and keep in touch, connect with NEESAMA, support the NEESAMA initiatives, and also support each other and keep in touch. And I've remained the convener for the meetings until now, which I think can evolve and change in the future, I suppose, with new ECRs coming on board. And I don't think, if I'm mistaken, if I say that the meetings have provided us with so much perspective and a sense of social connection at a time that we were really socially isolated. And it became a source of, unsurmountable amount of strength in very trying times. Because I remember in some of the meetings, I sort of noticed the difference in all of us. Now, I remember some of the meetings, how Sophia was when she was alone in Melbourne, and how stressed she was and how she was trying to keep up with all the work, versus how she is now when we meet and she's back in Pakistan with the family, the level of stress and how she's, she's laughing, she's less stressed. You can really notice this. I suppose this happens when a bunch of psychologists meet, you end up observing these behaviors. And then even going through personal loss. Now in our team, Aisha and the entire family who have background, they've been through COVID. I know Mithali has gone through personal loss that have impacted her, and she's trying to get through her PhD work. So we have, I think, as ECRs and young professionals from the nearby South Asian countries have just been in touch and connected and given each other that support and I think strength to get through. So that's been amazing. And even with our PhDs and getting that work done and meeting deadlines, all of that. So I think we are also now coming to a point as a group, as a collective, sort of coming out of COVID, coming to our end phases in PhDs, and also thinking about what we can as a group do for the future, research-wise, training-wise. Mithali very correctly today mentioned about how we've been discussing about contributing to the webinars and also sort of doing some collaborative work for the future. So that's sort of where we are at, and what we have, or what I have really gained and obtained from being an ECR. So thank you very much. And I think over to Mithali or Aisha to share their experiences.
Mithali, go ahead.
You can go ahead. It's okay. I'll go last. No problem.
Okay. So I was it's a great pride for me to be the part of this wonderful and beautiful family. And thank you, Ran. And you mentioned, I have a very good connection with you and Mitali through the meetings. And Ran, personally, we chat on WhatsApp regularly with so many issues with personal touch as well. And from NEESAMA, the last 2 years, where the Cope with COVID study, the involvement was a very good initiative from my side, I think, and this is a very good opportunity from NEESAMA as well, because through this research, I came to know the areas of improvement of mine in the research area, as well as the collaborative work, the wonderful collaborative work, all the meetings, and especially I felt so connected when my colleagues of NEESAMA asking me for my parents, for my physical health, Dr. Adi, Shekhar sir, Ellie, Jackie, so Ran. So that time I felt that this is also my family and they're concerned about me. So it's professional development as well as personal growth, and what should I say, the security that I'm secured here. I have the accessibility to share here. And a wonderful experience was with Shekhar sir. We jointly arranged a Facebook Live from my university page, and it's on childhood trauma and its impact on the adult personality, as I'm working with the young adults. So that's a very good viewed program in my page. So on behalf of my team, I again really thankful to Shekhar sir, and through NEESAMA I got that opportunity. And the total thing, in our NEESAMA meeting, we discussed so many things in the case of professional, as well as we love with the politics of our country and the COVID situation, how we are dealing with ourselves as well. So it's a very good journey, but I'm missing the summer school program, because that was a very good opportunity to keep in touch with all of my ECR friends, because we have a very good pictures on the last program, and we enjoyed our shopping a lot in Bangladesh. So I missed all the memories, and whenever Adi, the slideshow with all the pictures, I become nostalgic with all the pictures. And from bottom of my heart, I am thankful to all of my NEESAMA members, and really thankful to Naila Appa and Farzana Appa for giving me the opportunity, for giving me the information regarding NEESAMA, and Dr. Adi for your friendly behavior, that I never think anything that I should ask this to Dr. Adi or not. I just immediately ask you. So that is something, a very good exposure of yours for as a you are on that position. I'm not. So this accessibility give me the value. So I'm really thankful to this family to make me proud, to make me valued, to make me loved. Thank you so much.
I think, as Aisha rightly said, it makes you feel secure. So I remember Dr. Shekhar telling me for the first time that there is an opportunity and you can apply, and you might just get selected. At that time, I thought, oh my God, like, how is that going to happen? And I remember being very happy when I was selected. And then the Bangladesh meet was just amazing. It was 4 days, actually. Yeah, 4 days of like fun as well as work, concrete guidelines as to how we are going to move into the future. And I was more than happy when I heard that the ECR summer school had gotten funding, but then unfortunately, because of the pandemic, that plan got delayed. I'm still hoping that it happens sometime in the future when when people start meeting face to face and when it's safe, most importantly. For me personally, I think I had never imagined that I could be a part of an alliance this big across countries. And I didn't have actually even a picture of how it could be. But slowly now, with having these meetings with the ECR and also having these NEESAMA meetings once in a while, I'm beginning to understand that there is a lot of potential that, you know, we can actually use to also further the research that we all are doing separately, as well as contribute to what NEESAMA as a community is trying to approach, which is to reduce the gap between service delivery and training. I realized that even during pandemic, NEESAMA actually proved to be a gold mine. Unfortunately, because of my own personal losses, I wasn't able to access a lot of the opportunities that came my way. But I was happy to be a part of the child psychodynamic psychotherapy course. I did attend a few webinars. In our past meetings, we have been discussing about how can we actually, now that we are all picking up the pieces and feeling all right, we are actually making some concrete plans to do cross-cultural research, and maybe even, a project, which we will see later how to get funding for it. But we are trying to actually think of an idea, a research problem, which we all can contribute to, so that also, in that way also we can give to the community. Personally, for me, other than the fact that I got to meet so many people at such different positions from different countries, I think that experience is something that I wouldn't have gotten. I was able to deliver a CPD in Bangladesh, which I realized was a very big opportunity. I got to speak about the research area that I feel very passionate about. So that's all thanks to the efforts of NEESAMA steering committee, including Dr. Adi and Dr. Shekhar, for introducing me to this group, this community. So I'm really looking forward to actually putting plans into action in the coming future, as the three of us at least, Ran, me, and Sobia, we are moving towards completion of our degrees. So I think we will have more space and time to actually put plans that we all actually have been discussing, including Aisha, into action. So my experience has been great so far, and I'm hoping that continues. And I'm really hoping for the ECR summer school to happen. Yeah.
I think I'm just gonna jump in there and say these like ongoing topic about the summer school, mainly because I think we were so ready, and from my end, I remember I had gotten leave approved from the university and like all ready to go. So that's like this thing that we couldn't achieve. At the same time, just want to mention, I think sometime mid or early this year, when we're thinking about ECR webinars and research and things, it was just, we were overwhelmed. There were so many things going on. And I remember Mithali and I would just say, no, later, we have to push. I can't, there's no space for us to take anymore. But the last meeting, I think I'm yet to share the minutes with Adi and Catherine, but the last meeting we had was I think the vibe of the ECR, our discussion was completely different. And all of us have come to sort of at a point that we've been through like the roughest stage, I think, that we had faced, and feeling more hopeful. And we were really hopeful at the end of the discussion. But so I think everyone brought like passion to the table. We actually came up with some research ideas. And even I think Mithali may be visiting Sri Lanka in the coming months. And so we are also, so we were discussing all of this and meeting up on our own accord. But it's been really wonderful. So thanks, Adi, thanks, Prof. Jackie, and the entire NEESAMA steering committee, including, I think, I have to personally thank also Professor Pianjali, who encouraged me to apply for this alliance. Thank you very much.
Thanks, guys. We knew you'd say nice things, otherwise we wouldn't have invited you to speak. No, I'm joking. We wanted frank feedback. It is quite humbling, I have to say. I think I speak on behalf of Jackie, Shekhar, and myself. I know Pianjali was on earlier, and Sabahat from Pakistan. We're quite humbled by how much of an impact this has had a productive, supportive, nurturing impact this has had on all of you. Just delighted to hear that, that is really what NEESAMA was all about, and long might that continue. I promise to try and explore the possibility of, a summer school again. I just don't know at the moment. I think things will become clearer maybe post-Christmas as to, whether there's funding and also what the situation is. I think I speak for Jackie and myself, certainly on behalf of the university, that I don't think that we could really live comfortably with ourselves if we invited you and the situation here was not safe. We feel responsible for you all, and we just want to make sure that things are as safe as possible. There'll always be an element of risk. You cannot get rid of it completely. But yeah, we absolutely will try and find out more about that. I think the other thing just to say, Ran, I know you all talked about feeling somewhat, I suppose, overwhelmed by circumstances. I mean, thank you for sharing that with great honesty. None of you need to apologize for it. We have all been overwhelmed, all of us, at various times, with personal and or professional losses, issues that have happened. I think if the one thing that COVID has taught us all, certainly has taught me, and I have to thank Jackie and also Ellie for reminding me constantly about this when I'm either hard on myself or I say something not so nice about someone else, is we need to be kind to each other. I think there are some fringe silver lining to all of this. We just need to, we're all human beings. We've all got demands on our time, and it's okay. We'll do it as and when we can. So that's fine. But what's been so positive today is to hear this lovely stuff, hear that there are concrete plans. I think it'd be amazing for you all to have, to do an ECR series of webinars. You're going to produce those topics, send them to us. We'll start looking at dates. We will circulate those first to the wider NEESAMA community. Also, when you're suggesting topics, think about speakers, from within NEESAMA, but also other people from your home countries. Talk to each other and find out, there's something about criminology. Subia would have links, but, do you guys have links in your own home country as well? So, be solution focused, come up with ideas, but also like a pre-packaged, this is what we propose kind of thing. And then we can look at dates and make it happen. So that's there. We look at skills development as well and put together some resources. So we'll definitely think about that. So if I could now move us back onto the wider issue about really sort of further training and development, which is really what today is about. I hope it's shown to all of you that have logged in from time to time, and for those of you that are watching this recording later on, that despite COVID, despite not having met for 2 years face-to-face, NEESAMA continues to be a vibrant community, has achieved a fair amount from a research perspective, but also a training perspective. We have continued to go from strength to strength, but how do we progress this further? What are the areas of development, and how do we make it happen? And then we, I think, need to still come back to Dr. Hakimullah's point. I haven't forgotten, how do we help Dr. Hakimullah and the whole Afghan nation as well. So first, let's just think broadly about, what I'd really like your help on is thinking about a series of, we are going to do the webinars, but do we need to plan something else? How can we do that, say, for the next 6 months to a year, sort of a program of work? So perhaps I'll shut up. Any thoughts on that matter? I am perhaps looking at Matthew and Shekhar as probably the senior most faculty here amongst us, with tons of experience collectively between the two of you. As Shekhar pointed out, the sum is more than the parts. So I think Shekhar's coming in. So over to you, Shekhar.
Yeah, Matthew and I are collectively 130 years old.
Shekhar, we weren't trying to imply that. Collectively, you don't look a day older than 80.
Matthew and I continue to have the vibrancy that we shared when we first met in 1981, 40 years ago. I think we share the same enthusiasm for work and for music. And I have a bit of a cold. I'm still recovering. So if I sound ill, that's because I am. Very quickly, Adi, I'm referring particularly to Dr. Hakimullah Sali. Dr. Hakimullah, I'm running for the last 1 year in India a national initiative, an integrated resource on child protection, mental health and psychosocial care. So we are looking at pan-national approaches and how to work with systems. So we would certainly be able to assist you with not just resources, but with also an execution plan of something that you can do very easily to really look at child mental health and child well-being in the current situation as it exists, both the socio-political situation compounded by the whole COVID agenda. So I would be honored as part of Samvad to provide you this assistance. And we have your email ID. So I will be in touch with you to actually plan something which you can execute. We could get into a series of meetings as well as some kind of training activities. And we'll share with you the materials. In one of the sessions, we'll also take you through the materials and navigate it to show where what is available, with particular emphasis on COVID and children, trauma and children, collective trauma and children, and community approaches to child mental health, as well as how to work individually with a child. So that's one thing, Adi, that as part of the NEESAMA initiative and what Samvad is doing, it would be an honor to assist the children of Afghanistan. That's one thing I wanted to say at the outset. I'm sure Matthew has a lot of thoughts, and then I'll come back. I have some other things brewing in my mind which I'd like to share. Matthew.
So I think on the issue of training, as Adi mentioned, there are lots of things that we can do. And there's a lot of stuff that we have learned to do online in the last 1.5 years, because all our training has gone online. Our family therapy training, our psychotherapy training, our specialized courses, whether it is in geriatric psychiatry, child psychiatry, forensic psychiatry, or rehabilitation, everything is actually gone online. And I think one of the good parts of the pandemic is the fact that in the last 1.5 years, we've become quite used to the fact that much of training and even supervision has had to be done online. So in the last 1.5 years, all the supervision that I've done, whether it's individual or family therapy, it's all been online. And there's hardly been any face-to-face meetings with clients or with students. So that's something I think so in that sense, you don't have to be you don't have to be there face to face. You can be in any part of the world, and you can actually have training which is fairly good and experience that is sort of given to trainees as and when they want and what they want. So if you look at the link that I sent you, and that is the Niman's Indians link, which is the YouTube link. You can see that there are courses that we did through last year and before that on various aspects, family therapy, child psychiatry, and there are actually sessions that Isha and other people have done. There's stuff on forensic psychiatry, there's stuff on rehabilitation. There's a whole bunch of stuff that, you know, our telemedicine center and also the Niman's Digital Academy has sort of put together. For people from other countries, especially in the region, just be aware that there are the Niman's Digital Academy and the Telemedicine Center. Both these are two hubs at Niman's, and they have actually started online certificate courses in mental health. So you have 6-month courses and 1 year sort of certificate courses in mental health, and you get a kind of certificate from the Niman's Digital Academy. And as far as I understand, anybody can actually apply for it. It's not restricted only to people from India, but you know, anybody, I guess from anywhere, but especially from the South Asia or the Southeast Asian region, can definitely apply, because it will all be similar in the sense of what happens in the LAMIC regions. So I think that it's absolutely open as far as any kind of training or inputs are concerned. And so also for, you know, research. I mean, we've gotten to do almost everything online, and I know that, you know, we've met almost every month, I think, or every few weeks in the last 1.5 years, especially with the NEESAMA group. So I think it's all totally out there to tap. And I'm really thrilled that, you know, something that started just barely 5 years ago has, you know, has held together through this pandemic. And I'm particularly pleased to hear, and it's lovely to hear, that the ECRs have actually found new friends, and they've actually connected with each other and been supportive with each other, you know, throughout these 1.5 years. I mean, I didn't know about all that. I didn't know they were all still connected, but it's great to know that, and it's great to, you know, and then if there is anything else that any of us can do, I think we are happy to help. That's all for now.
Thanks, Matthew. I've just put the link for the telemedicine as you had proposed and suggested. So that's there with everybody. You know, please have a look at it. And if, you know, if you're struggling to access details about the course or other things, please let, you know, Matthew, Shekhar, and or I know. I will try and get the right link if needed. But I'm sure it seems a very user-friendly, accessible website. So, you know, do offer it. Gunjan has said that they have a child and adolescent mental health training and adaptation from WHO MH GAP intervention developed by our child psychiatry team. We can share this with the NEESAMA community. And this could also be useful in Afghanistan and other South Asian countries as well. Would be happy to discuss these further with you. Thank you, Gunjan. That's really helpful. And I know that when actually Jackie and I met up, even prior to NEESAMA, on a different meeting in Kathmandu that Arun attended and other colleagues attended, this was being discussed then. It was just being finalized at that time. So it's great to hear it's happening and it's being looked at. And I hope it's being evaluated as well, because that's where the research comes in. And, you know, it would be nice to know about the evaluation at some point. Perhaps you or other members who are involved could look at evaluating. And if it's not being evaluated, we could think about it. That's the thing that we could think about in terms of a research program as well. I think Biplab had mentioned about some online CPD among the participating countries in South Asia. So Biplab, lovely to see you, first of all, Biplab. Really nice.
Yes, thank you very much. Ali, it's a great pleasure for me that last 2 years we could not especially I could not connect it with you, and I think I missed so many things, so many training, so many research work and other activities that from the last day. That means yesterday and today I heard lots of presentations, lots of lectures delivered by you, Jackie, Farjana Appa, and another from Sri Lanka, and today. And I thought I have missed a lot, and very grateful and very pleasure to see today and yesterday the known faces started to see in the Nepal for the last 2 years. And Aisha and another Gunjan, they mentioned it's a very, very good family and feel secure. I also feel very, very honored to be the member of this NEESAMA family. And now I'm not taking enough time. I'm just mentioning two things. Personally, I was not involved, could not involve because in the last pandemic, I had 2 times I was infected into COVID-19, and once I was hospitalized for a long time. And second time, my family was involved, and I was also involved with the National Committee of Mental and COVID, so had to give time to the meetings and policy making decisions. So sorry to say I could not attach with you for the last 2 years, but really happy to see the activities what was done by NEESAMA in the last 2 years. And what I said about CPD, I can give you the feedback I could not give you after that Dhaka summit. After CPD, that means that is literally we found 640 people participated in the in that CPD. That was a bit lesser than, because some people was involved in the both 2 or 3 sessions. So calculated some will be lesser than that 6 but a huge number of people was involved in the CPD. And Dr. Farjana, Alginapa, Aisha, and Nala Madam all will know it was a very stimulating session. And after this CPD, lots of discussion was going among our mental health professionals in Bangladesh. I was thinking it's personally someone can take some training, personally some can involve in research work and to develop their activities and professional skill. That is very important. But CPD, what you can do, what that CPD can do is that I felt it is a very good stimulation for those who participate in the sessions that you designed among about suicide, bipolar, depression, or so 6 items at that moment. I saw after the CPD, that means those who our students, our colleagues, and friends, those who are involved, and participated in this session, they were feeling very stimulated and was asking so many things, and how to do again, how to go through some meetings, training, research work, lots of them. And I think it will be a very good opportunity to connect the people of India, Bangladesh, Sri Lanka, Nepal, also Afghanistan, and that will help the mental health professional to develop themselves as well as to how to give service to the general people. And this may help also to the Afghan current situation, our experiences, that means the experts' experiences and the process, even from their research and other data also could be collected very easily. So that was my 2 observations, and thank you very much again to see you again, and I hope to we'll be connected with always with NEESAMA people and NEESAMA family. So my salam to everybody. Thank you, Adi.
Yeah. Thank you, Biplab. No, absolutely no need to apologize. Rotten luck for you to get COVID twice. I'm glad that you have not lost your passion and your sense of humor still, which is good. So coming back to the issue that you have raised, I think, of course, Biplab, as you have heard, we are currently doing some webinars and we will be planning more webinars. But I think the issue that you're raising is about not just webinars, which are like, an hour and a half long, maybe, planning sort of half-day events on CPD. If just to remind everybody, Biplab referred if some of you could not be, I know Hakimullah could not attend and his colleague could not attend the whole meeting in Bangladesh. What we had planned, Hakimullah, was a morning session and an afternoon session on the last day of our 4-day meeting. And in the we had 3 parallel sessions going on. The parallel sessions covered topics like difficult to treat mood disorders, suicide, dementia, training for mental health professionals. There were 6 topics. Apologies, I've forgotten, I think, 2 of them. So we can try to organize, collectively within NEESAMA, some CPD training event, half-day event that we can organize via Zoom, say, and we'll just do 1 session at a time, because I think trying to do 3 parallel is a little bit, well, it's very ambitious. Let's just try and get 1 right first. Maybe, Hakimullah, it would be nice to hear from you of the topics. And I don't mean that you need to tell us today, but since we want to do this to help Afghanistan, that is who collectively all of our countries want to help you. It might be nice if you could discuss with colleagues, if you could discuss in your Afghan Psychiatric Association that you have set up, and ask, via email, WhatsApp, whatever is the best way, and maybe send us 3-4 top topics that they talked about, maybe depression, I don't know, anxiety, autism, I don't know, whatever the topics might be. You could let us know, and then we can be in touch and we can try and organize something to start in early 2022. It'll obviously be mainly for Afghanistan, but we can, that'll, I'm sure, help other people in South Asia as well. I don't know, it's just a thought. What do you think, Dr. Hakimullah, about that proposal?
Yeah, thank you for getting attention for Afghanistan. Generally, if we have a next meeting, I will present about profile of mental health of Afghanistan, and also mental health service in Afghanistan, and how our people affected from mental health. That from 4-decade war, we affected and the unstable situation of our country. These are the problems that we affected more from other countries that you are living there. Also, I will discuss this issue what you discuss here with our colleagues in our steering committee of our association, and after that I will select the topics, and after that I will communicate through email or through WhatsApp with you, and then you will plan for this.
No, thank you. And I don't know what everybody feels, but I am certainly going to discuss at the next steering committee meeting. Perhaps, Dr. Hakimullah, would you and your colleagues maybe like to do a webinar on mental health systems and situation in Afghanistan? A NEESAMA webinar, invited 1 hour, you and maybe 1 other or 2 other colleagues just talk about what you were just saying. You said you would do a presentation about the situation in Afghanistan, how the system is configured. It would be an honor for us if you would consider doing it, but we will discuss it at our next steering committee and then write to you. It's not urgent. We will need time to plan and advertise it widely, and maybe plan for January or February time in 2022.
Okay.
Yeah.
I will. Okay, I will.
Thank you. Yeah. Because I think that would be a fantastic topic. It would allow us all to gain a better understanding of systems, because sadly, we have not been able to meet you face to face. Yeah, and thanks, Isha. So, we should think about doing that, and hopefully that will, the online CPD session would be a good way. Thanks, Biplop, for suggesting that, and we could target on topics that mainly help Afghanistan or are a priority for Afghanistan. I just had one question to you, Hakimullah, and please feel free to discuss it with colleagues as well. Sometimes when Jackie and I have been collaborating with some of our partners in South Asia, not with Afghanistan, but with some other partners, there has been a little bit of tension between the government in that country and the fact that we are from the UK. So what I'm just trying to politely ask is, we do not want to create problems for you or your colleagues. Will it be okay with the new government if you were doing this as, you know, or getting any kind of, not monetary, but other support with, you know, some partners based in the UK? Would that be all right?
I think that you know about the new government, in the all ministries of our country, they selected those who are not their profession. But fortunately, for the Minister of Public Health, they assign one of the doctors who he's a urologist, and he has close coordination with us. And I have met the new minister, and they support us. And also I discussed the WPA contribution with him, and he will appreciate that. And he assigned one doctor with us and told me that we will support you in all the aspects of what you want from us. So that they support us. Our new government minister support us, and they has close coordination with us.
Okay, that's really encouraging to hear, because the last thing that the steering committee, and in particular Jackie and I, who are obviously based in the UK and represent the UK, we do not want to cause problems. Perhaps if you wouldn't mind, just check in one more time with the minister, because WPA is a worldwide association.
Yeah.
Whereas NEESAMA, you know, does have one of the key partners is the UK. And I know that the current Afghan government is particularly anti, for a variety of reasons, anti-US and anti-UK. So just make sure it's okay. We don't have a problem. But what I want, I think we don't want you to have a problem.
But whatever I have knows from the new minister, and whatever I have discussed with the new minister, he mostly don't want to touch to political issues. Just
Okay.
He want to how to establish the Minister of Public Health, and how they coordinate all associations to each other to work together.
Yeah. Okay. Perfect. And absolutely, Jackie and my colleague Ellie Smith, who you can probably just see on your screen, and myself, we are not here to discuss politics. In fact, we run away from politics. It's not our thing. We just want to help develop research links, training links, and help you develop services. So as best as possible. We have already heard about the fantastic models that Shekhar has talked about through Samvad. They can help you. Gunjan has shared some stuff from Nepal. That's fantastic. And anything that, you know, the wider NEESAMA community can help with, we definitely will. So let's get this going. You know, Shekhar, I know, is going to send you an email directly. Gunjan, please do send as well and be in touch, and then keep us posted on how things are developing. Also, just let us know as and when about the CPD sessions. Yeah. So before I just move on to sort of concrete next steps, any other thoughts from any of you? Because I know it's been a longish meeting. We've been at it for 3 hours with breaks. It does get tiring, and it's the second day. And unfortunately, I can't, you know, Jackie and I can't even offer you any refreshments. Zoom hasn't developed a technology whereby I can send you a cold coffee or something from here. It'll all have to be cold from the UK. Maybe you could send some garam garam samosa or gulab jamun or something exciting, a kebab from Afghanistan. That would be nice.
Sure.
So any other comments or thoughts before we move on to just planning some concrete next steps? Farzana, any thoughts from you?
Yes, I was thinking about the I'm from Bangladesh. I'm Dr. Farzana Islam. I'm a child and adolescent mental health specialist here. And we have developed in Bangladesh a tool which is for developmental assessment of children from 0 to 18 years. I have just sent in the chat box that Professor Naila Khan in Bangladesh, I'm sure she will be very interested to help Afghanistan. If you are interested, you may contact with her regarding this is a freely available tool in the online with the online training module. So I think
to help
that
Hakimullah, but also other colleagues. Yeah.
Yes,
so,
of course, everybody. Right.
Hakimullah, if you would like, I can put you in touch with Professor Naila Khan as well. Yeah. So
I think we connect in through emails, and I have.
You have her email.
Her email,
yeah. Perfect, because I know she wrote the letters of sponsorship. Unfortunately, they didn't work for the visa, but you have her contact details. Yeah. Okay. Any other thoughts? Anybody? No? Okay, so in terms of next steps then, so the first thing is that we need to get the NEESAMA website up to date, up and running. So Maya and I will work on that, largely Maya, and we will get that up in give us about a month or so to get it as up and running as possible, take out all the Latin from it. And then Shekhar has very kindly offered that his Samvad tech team, they're fantastic, will also help, because Maya can change text, etc., but Maya won't know how to embed stuff in YouTube and put the links for all the videos on. So we need a little bit of help, but we will try and get it done. Please, then once it's ready, we will send you an email address, and please critique that and provide feedback, what needs to change. But most importantly, anything that you all are doing that you think is NEESAMA relevant, any webinar that you're doing, any teaching that you're doing, any new measure or paper you have published, please share with us so that we can put it up on the NEESAMA website as news, right? Because otherwise people won't come to the NEESAMA website. We need people to come to it and increase the footfall. That's one thing. Second thing that I think we need to think about is, when do we have our next meeting? It sounded like this virtual meeting has actually worked quite well. Jackie, spoke this morning and said that, it's been helpful. Matthew, high praise from Matthew. And that's very nice to hear, Matthew, that you thought that, having this 2-day meeting was good. Biplov mentioned, how much he's not been able to attend. But he found that there's been a lot we have achieved, actually. And I think, speaking for myself, I have been quite moved and quite emotional about, in all the ways that I hadn't thought about, that just being involved in NEESAMA and all the meetings have been helpful. And actually, it's made me reflect how much of a lifeline the Cope with COVID meetings at 8 a.m. UK time were for Jackie, Ellie, and myself. We used to get up early, energized, ready to see everybody. So yeah, I think we should try and plan another 2 half-day meeting, maybe in 6 months' time. What do people feel, or should we wait a year? In 6 months, Shekhar, 6 months. Ellie is nodding, Jackie is nodding. I don't hear any dissent to it. So let's just go with 6 months then, shall we? And we'll plan a meeting. We'll discuss this at the next steering committee meeting and propose some dates. Hopefully that will be well represented. We'll obviously try and avoid holidays, like public holidays. We've got Murli joining. Hi, Murli. Don't turn your camera off. Lovely to see you. Yeah,
good to see you.
Yeah. We're just planning next steps. We've had I know, Murli, you're busy with the MS role and various roles at NIMHANS, but it's really great that you've been able to join us towards the end of our second day. We've had a very productive 2-day meeting, and we were just planning that we'll have another meeting rather than wait 2 years. We're actually going to have another 2 half-day meeting, just similar to this style, in 6 months' time. So we will plan something in 6 months' time.
That sounds great.
And we will be having, we have a steering committee meeting coming up in November, and we'll discuss it at the November meeting and propose some dates, just to avoid things like Holi, particularly, I'm thinking in India, but there will be other festivals in other of the NEESAMA countries, including here, Easter. We want to avoid holidays and things so that there's maximum turnout. We will do it in the morning UK time, which works well for you all in South Asia. We will plan a series of new webinars. I think the steering committee, I don't want to speak for them, but I'm sure the steering committee will be very supportive of our first webinar in 2022, focusing on Afghanistan mental health needs. Murli, we have Dr. Hakimullah Salah from Afghanistan, who's joined us today. He's our one of our 2 Afghan members. There he is. And Dr. Hakimullah, Dr. Murli is the medical superintendent for NIMHANS, big boss.
I have heard his name, yeah.
But a wonderful champion and supporter of NEESAMA all the way. So in fact, Murli, Hakimullah suggested that, because he's very keen that NEESAMA support, but he felt that it would be nice for us to know what the needs are in Afghanistan, the particular needs, and indeed how our service is configured in Afghanistan, which I think is such a polite and very helpful way of saying, first get to know us before you offer to help us. So we asked him if he could do this as a webinar under the auspices of NEESAMA, which he has very kindly agreed to do. We are also planning a series of NEESAMA webinars run by the ECRs. So Mitali, Ayesha, Ransarini from Sri Lanka, Sobia from Pakistan, they will curate topics, propose, and help that develop. So our young talent is developing as well, which would be fantastic. And we are going to think about some, how we did the CPD event in Bangladesh. Biplab was very keen. He felt that actually that stimulated discussion for many months after in Dhaka. So he's very keen that we try and do that online. So we need, in fact, what we have asked Hakimullah is, what are the main topics that Afghan psychiatrists need? And once they decide, because Hakimullah is chair of the Afghan Psychiatric Association, he can do that, and let's prioritize for them. So those are our concrete next steps. And there's only one other thing that I want to bring up, which is to say that the steering committee members are up, as it were, for renomination, or because it's been a while. We set that up in 2018 in Kathmandu. And not all steering committee members have also been able to engage as much as some others have been able to engage. So we will be putting it out there. We'll be discussing this at the next steering committee as a formal item, that if people want to continue, they will need to seek renomination, or people get the chance to step down as well. So that's something we will discuss, and then we will share with you all as the wider NEESAMA community as well. And my last thing to say is, if you all are aware of folk that would be interested in joining NEESAMA, because we're doing everything virtually right now, please ask them to approach myself and copy Catherine in. And then what we will do is we can collate all of those and present it to the steering committee, and then perhaps invite them. So they should have an interest in either training or service development or research. It doesn't have to be all three. And it has to do with mental health. So they could be from any background: psychology, nursing, psychiatry, other members of the MDT like occupational therapy. We want to widen our net as well. So please let other people know and pass the information on. And Matthew saying 6 months is a good time to meet. 1 year is too far away. I agree, Matthew, because I miss seeing you. And Dr. Algin is saying, I have included old age psychotherapy sessions from our residents from this October. Okay. So any last words from anyone? Of course, Jackie, please.
I just wanted to say, Adi, on behalf of everyone else, thank you to you, because you've kind of really been instrumental in keeping the show on the road. And we've heard, some lovely comments from members of the NEESAMA family today and yesterday. And actually, you've been the driving force behind all of that. And, it hasn't been easy. It's been challenging in a multitude of different ways, and I know how busy you've been. So just on behalf of all of us, I just wanted to say a big thank you to you.
Oh, thank you, Jackie. I think hearing, I'm quite speechless and I'm quite emotional. So yeah, it's been a lifeline, It's a way of staying connected with, obviously, our friends and family in India and South Asia. It's been tough this past year and a half. This is something that's really, really close to all of us. And while it's very kind for you to say that, I think it's everybody's energy that keeps me inspired to keep it all going. So it couldn't happen without all of you. Some of you, all of you that are there, but also all of you that might be watching this online on the website in the next few weeks. And on that note, I wanted to also say a huge thanks to the Samvad Tech team. Shekhar has introduced us to them. They're fantastic, absolutely amazing. People are welcome to contribute, but please don't say anything about me, because I think I will just be a blubbering idiot soon. But thank you, Jackie. Coming from you, it means a lot.
Thank you, Jackie. Thank you.
Right. Okay. I think that means we've come to our natural conclusion. We're finishing a little bit early. We look forward to hearing from you, Dr. Salah. On behalf of Afghanistan, we will be in touch. We will let you all know. And thank you so much to all of you for either presenting or contributing to all the work that NEESAMA does. And really fantastic to see you all. Please stay safe and take care. Lots and lots of love.